While Canadians across the country line up for COVID-19 booster shots, the World Health Organization is warning those third doses are not the way out of the pandemic.
About 20% of all vaccine doses administered every day are currently being given as boosters or additional doses. Blanket booster programs are likely to prolong the pandemic rather than ending it by diverting supply to countries that already have high levels of vaccination coverage, giving the virus more opportunity to spread and mutate.
So, to boost or not to boost, that is the complicated question. Dr. Peter Singer is a special advisor to the Director General of the World Health Organization, joins us now. Dr. Singer, thanks for coming on the program.
Thank you for having me, Paul.
So, the latest healthcare data from South Africa, Denmark, and the United Kingdom is suggesting a lower share of people infected with Omicron are likely to require hospital treatment compared with the Delta strain. WHO is maintaining it is still too early to see the whole picture. Why is that?
Because this virus spreads very quickly. It's in 106 countries. We are concerned about a surge. We do have to raise our guard. Everyone does, to protect the health system. And the things you're talking about, vaccines, limiting gatherings, opening the windows, masks, tests. Yesterday, you described these as tools in a toolbox, and I think that's a good way to describe them. Vaccinating the world is another tool, and that's the way we can raise our guard, protect the health system, and protect people around the world.
What do you make, though, of the rapid decline in South Africa?
The issue here is the uncertainty. You know, there's a time lag between when you get cases, and cases are rising in Canada, and when you get hospitalizations. Secondly, even a smaller proportion of hospitalizations on a lot of cases can still be a big number and overwhelm an already strained health system. So this is the time to act. This is the time to raise our guard and protect the health system against a possible surge.
So your organization is warning against or advising against blanket booster campaigns. But if the WHO itself is saying it's too soon to have the full picture, why should countries pause booster shots?
What we're actually saying is that we're not against boosters, we're against inequity and vaccine inequity. And that's what Dr. Tedros has said. You know, we had an advisory group report today, and they said this about vaccination and boosters. Number one, remember that the goal here is to protect against severe disease and death. Number two, they're recommending boosters targeted to high-risk people and to protect the health system as the evidence evolves. And thirdly, they did express the very concern you stated, which was blanket boosters increase global vaccine inequity. And if there's one point I want to make here, Paul, it's that, you know, one of the best ways to protect Canadians or people of any country is to vaccinate the world, because that, you know, having the vaccine inequity, 7% vaccination rates across Africa, only 1 in 4 health workers fully vaccinated compared to 70 to 80% in Canada. Not only is it unjust, not only does it cost lives, but it also generates variants. And that's the way to keep this going. So if we want to end the pandemic, we have to vaccinate the world. That's necessary, but not sufficient. That means we have to share vaccines and share technology.
Is it, you know, in Europe, WHO chief is urging booster shots. It is calling them vitally important. So how do you square that? Is that mixed messaging for people that might sort of hear that? They hear your message, get the world done, and in Europe, they're saying get Europe done. How do you square that?
Well, it's a matter of balance, Paul. I don't think it's mixed messaging. I think, again, the primary goal of vaccination is to protect against severe disease and death. We're not against boosters. This group and WHO is recommending actually targeted boosters because that's how to save the most lives, to people at high risk, to protect the health system. The blanket boosters do run the risk of making global vaccine inequity worse. That's unjust, it'll cost lives, and it's ultimately self-defeating because that's the way to keep the pandemic going. You know, to end the pandemic, you can't just think within the borders of any country. You have to think globally to prevent the next variant from coming. It's very people know Delta, they know Omicron. The next one will be coming unless we vaccinate the world. So that we didn't do well on that in 2021, to put it mildly. And we have to do better in 2022 if we want the pandemic to end.
I want to ask if I should feel guilty for getting the booster shot then. I mean, the way I think a lot of people see it is if I can get fully vaxxed and boosted, that's one less person on the planet who's likely to, get it and spread it. So am I wrong in seeing it that way? I take your point, and it's a very valid and strong one. Got to do the world, but at the same time, I kind of want to do me too. Am I wrong to feel that way?
I don't think. Look, our goal is not to make anyone, and Paul, not you, to feel guilty. Our goal is not, and we have a lot of respect for the decisions governments have to make to protect their own people. But at the same time, as we're focusing on these measures within Canada, if we want to end the pandemic, we have to vaccinate the world. So it's really a matter of balance. And again, that means sharing vaccines. And it also means sharing the technology, because, future pandemics, other variants coming, we have to be prepared. Countries have to be able to make vaccines for themselves. So that's intellectual property, it's know-how, it's capacity. It's in our common interest to end the pandemic and to essentially prepare much better for future variants and for future pandemics. And so, no, please don't feel guilty. We respect the individual governments as well and their decisions. But the point I want to make is this isn't just a moral question. This isn't virtue signaling, that it's unjust, that it costs lives. All those things are true, not to vaccinate the world. It's also in our self-interest to vaccinate the world, because that's how we'll end the pandemic. That's how we'll tamp down variants. Again, necessary, but not sufficient. You need the public health measures around the world to end transmission. One of the best ways to keep Canadians safe is to vaccinate the world. And we can do those things at once, and we have to do those things at once. And the whole world has to step up and do a much better job in 2022 than what Dr. Tedros has described as effectively as a moral catastrophe, which is also very self-defeating of global vaccine inequity.
But we don't have a ton of time left, but just, to people who then hear about South Africa hesitancy, or I think, was it in Nigeria, 1 million doses destroyed, it going to waste in a sense, or people turning it down. What do you say to people who say, well, what's going on there, right?
What I say is that when you have 7% vaccination in a country, there's a vaccination hunger, and supply precedes demand and distribution. Obviously, there's supply and distribution issues in every country in the world, and we have to tackle both. But if you don't have supply, or you don't have predictable supply, which is one of the issues of expiring doses that you mentioned, then distribution becomes much more difficult. And so, yes, we have to tackle distribution, but what comes before distribution is supply. And those are both needed to vaccinate the world. And it's not only about vaccines, it's also about sharing the technology so countries can make their own vaccines and be prepared themselves against the pandemic. It's also about self-reliance, which is a really, really critical point about ending this pandemic and preparing the world against future variants and future pandemics. There will be another variant if we don't vaccinate the world. And this one was predictable and possibly preventable. And so wouldn't it be better, an ounce of prevention is worth a pound of cure. Wouldn't it be better to prevent these things than to be dealing with all the things you're talking about, rapid tests and, scrambling around to deal with them? Let's prevent the next variant, or at least reduce the risk by vaccinating the world.
I'm going to answer yes. That would be better.
That's the right answer, Paul.
Okay, I'm glad to get that one right. Thank you much. Thank you for your time, Dr. Singer. Appreciate it.
No, thank you so much. Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.